Hi, this is Wolf. He's a lovely 8-year-old German Shepherd. Over the next few months, we're going to focus on the biggest thing that will cause your dog or your cat to have a decrease in life expectancy. And if you've been following what we do here at all on our Facebook page and at Highlands, you'll know the biggest killer of the modern dog and cat is dental disease, all right? So we're going to do a fair few things on dentistry. We've done a fair bit already, but we're going to focus even more in the next few months because it's getting your pet's teeth checked and then treated, if necessary, is the biggest difference that you can make to giving your dog a good, healthy life. And since dogs are such, and cats especially, so good at hiding things, they won't come in with a sore mouth or pawing at their mouth or anything else. So Wolf came in for vaccination the other day with his 3 companions. His owners are absolute dog fanatics. And I noticed that he had dental disease. Yes, it's early. Have a look. There's some staining here. There's some staining here and there on his teeth. So this is what we call grade 1 dental disease. So this is a light that will make plaque fluoresce and it'll turn red. So if you have a really good look here, you'll see the plaque there fluorescing and turning red, and even more so back there, so red or brown. I don't know how it's going to come up on the video. Now, as I said, his owners are really, really caring over us, so they want us to address these issues before they start affecting Wolf's quality of life or longevity. Now, again, being super caring, they wanted us to run a pre-anaesthetic blood screen. We like to do that on every dog, and the older they are, the more important it becomes. So as I said, he's 8, so we've run these pre-anaesthetic screens. So this is one particular test here, and red means bad. So you can see Wolf is perfect along that score. And then the other test here, blood sugar, kidneys, protein, liver, they're all black, so that's fantastic as well. So we know that Wolf's 100% good shape to undergo an anaesthetic. All our patients go on an IV drip anyway. So Wolf's owners have got fantastic peace of mind with the blood test and with the intravenous drip that he'll go on. So I've just sedated him, that's why he's panting a little bit, and in another 10 minutes we'll do his teeth. Yeah. Okay, we're here with Wolf, and you can see he's got his IV line hooked up. Peace of mind with anaesthetics. I was watching Monty Python the other day. I know I'm sort of sidetracking, but I'm not. And they had a really big section about hospitals and machines that go beep. Well, we've got machines that go beep here as well. So these beeping machines help monitor the anaesthetic. And now we've got a machine that doesn't go beep, which actually does the teeth cleaning. So Felicity's doing Wolf today. That's why she has got a mask on. That's for her safety, because the bacteria that will be loosened up by the scaling will aerosolise, if there is such a word, and we don't want to inhale them. Nurses are perfectly trained and capable, and it's legal to do dentals, scaling and polishing. The vets have to do extraction. So Felicity's looking after Wolf today. The procedure is exactly like you or I would have at the dentist, and the first part of the procedure is ultrasonically scaling. So you can see the machine is removing all the plaque, and you can see it's spitting water out. These machines the probes get quite hot, and we need to have running water to cool the teeth down, or cool the tooth down. Being a big mouth, this is going to take a long time. So once the scaling is over and done with, then we use these polishing heads or polishing cups, and each dog or cat has an individualised This is a polishing liquid. So when you scale teeth with an ultrasonic scaler, you leave a very marginally pitted surface on the tooth, and the polishing polishes those tiny little pits out of it. If you scale without polishing, you're actually doing the dog or the cat absolutely no favours at all. Scaling without polishing is, I'm trying to find an appropriate word and I can't. So I'm just going to say it's crazy stupid to scale without polishing, because the pitted area, the roughened area on the tooth, plaque will just start to form in that immediately. So you need to do the two together. And we've got a very fancy piece of equipment that does this fantastically well. This is one of the best pieces one of the best setups in the world. So we're still here with Wolf, and we found this horribly broken canine here. So you can see there's a long split up that way, and you can see it's all black here. Before we started examining it, that hole there, which is the pulp cavity, and I'll put a probe in there and show you what's going on. That pulp cavity in which I can put this was closed. It was closed with dentine and a few other things. So when we just scraped it a bit, that whole pulp cavity is open, and I can put the probe all the way down if it was straight. So that means there's an opening all the way from the air all the way through to the root of the tooth. And he hasn't got a tooth root abscess yet, but that will happen at some stage if we leave the tooth there. Plus, if you've ever had a broken tooth, you know how much pain you're in. And so he is in pain all the time. So we're going to do him a huge favour and take this tooth out. He is really good at hiding pain, and so he's not showing any pain. Now, when we take teeth out, he's under anaesthetic, and you think, well, dogs under anaesthetic don't feel pain. That's what anaesthetics are all about. Well, the fact is, anaesthetics don't really stop the pain. They simply may put you asleep and put your brain in a sleep mode, and you can't consciously feel things. But when you cause pain under anaesthetic, the heart rate goes up and the breathing goes up, so the body feels it and responds. So even under anaesthetic, we want to give extra pain relief. And therefore, when we take teeth out, we'll do a nerve block, just like you or I would have a nerve block when they do a root canal or pull a tooth out or whatever it happens to be. And so even under anaesthetic, Wolf's going to get a nerve block. So he's had morphine preoperatively. He's had getting a nerve block now. He's just had an anti-inflammatory injection, and he'll go home with a pain pack of tablets. So he's getting the ultimate in pain relief, and will have a very, very much more comfortable post-surgical period and recovery at home than if he hadn't had that combination of four things. We're really, really, really strong and focused on pain relief here. We just don't believe animals should suffer pain in any way, shape or form. And so we do everything we can to manage pain. So that's why we're doing what we're doing with Wolf. Okay, so I'm just starting work on removing this tooth of Wolfie's. He's had his nerve block. You might see the gum is slightly swollen there from the block. So we block the nerve itself, not around the tooth. So this blocks the whole of the bottom jaw. I'm just going to elevate all the way down. And then you've seen me do this before. Then I'm going to use my wonderful periotome. So we're going to use this periotome to ensure that Wolfie's extraction is as quick as possible and with as little damage to the bone as possible. If you remember, the periotome just digs a very small gap between the bone and the tooth. We're just making a very small gap, a couple of millimeters, and that allows us to pull the tooth out without making a huge dent in the, or cutting a huge piece of bone out to lever the tooth out with. Well, we've been at this for about 20 minutes now. It's a big tooth and it's taking a lot of time, even with the periotome. We're just starting to get to the stage where it's a little bit loose now. And so I should be able to get it out shortly, I hope. Dug all the way around it with the periotome. Now, if we hadn't had the periotome, I reckon this tooth would have been an hour, maybe a little bit longer, and a lot more pain and discomfort, what we call morbidity, to him. It's just starting to come up there now. It's really important that we don't break these teeth, because if there's any pieces left behind, they're awfully hard to get out at a later, well, not at a later date. There you go. So this is the classic iceberg, you know, a little bit of tooth above the gum line, huge tooth below the gum line. So that's it. As you can see, the hole is just the size of the tooth. There's no real hole there at all. That's just where the tooth was sitting, and I'll suture this. But if I'd have done this without the periotome, I'd have had to make a cut down there, create a gum flap, burr all the bone away on the outside, and then elevate the tooth. There's no way that this would come out. So we've saved Wolfie a heck of a lot of morbidity, and we've also saved me a lot of time, probably screaming and swearing as well, because sometimes these can get so difficult doing them the old way that it's really frustrating. I'm only joking about the screaming and swearing. But anyway, that's Wolfie and his canine removal and his cleaning. We've just got to polish it, suture the gum up, and then polish. And we'll give you one more look at this once it's sutured. You can see what it looks like. Because we haven't created a big flap here, the sutures won't cover the hole. I won't be able to get this hole closed, and that's okay. I'm not going to try to. So they'll be about half closed, and that's perfectly acceptable. So I've sutured up the extraction site from Wolfie. So you see there's a tiny little hole there, but the bulk of it is good. This is perfect. He'll obviously have to be on soft food for a week or so, and those sutures are all dissolving, so we don't need to remove them. And Felicity is now about to polish his teeth, and obviously they'll look a lot better than with all that blood on there. And then Wolfie will be able to go home in a few hours. So, one thing, if you like this video and you'd like to see similar things, please give us a like, and that no way we'll know we're doing a good job, and we'll keep it up for you.